Hello everyone, I am Dr. Deepa. Today we are here to learn about the topic the lateral wall of the nose. Before moving on to the lateral wall of the nose, we'll just have a brief note about the framework of the external nose or the formation of the external nose. The external nose is made up of the bony component as well as the cartilaginous component. In this atlas view, the blue represents the cartilage as we can see over here, the anterior view and the lateral view of the external nose. The bones which make up the nose include the nasal bone which is seen here. Then comes the frontal process of the maxilla, the lacrimal bone, and the cartilages include the septal cartilages, the alar cartilages, and they are small pieces of minor alar cartilages as well. Moving on to the lateral wall of the nose. The lateral wall of the nose is formed by the bones mainly. The bones which make up the lateral wall of the nose are from anterior to posterior, from before backward. The bones which is been represented in different shades of colors in this view. The lateral wall from before backwards is contributed by the nasal bone in front. Then comes the frontal process of maxilla behind the nasal bone. Then there is a small piece of the lacrimal bone behind which lies the part of the ethmoidal bone, that is the superior and the middle conchae of the ethmoidal bone. These are the parts of the ethmoidal bone. Beneath the superior and the middle concha lies the large inferior concha. This inferior concha is a separate piece of bone. It is a separate bone. In the posterior part, the lateral wall is formed by the palatine bone as we can see here in blue. It is the perpendicular plate of the palatine bone and the posterior part, the posterior most part of the lateral wall is contributed by the medial pterygoid plate of the sphenoid bone as we can see over here. So the medial pterygoid plate of the sphenoid bone. So these are the bones which make up the lateral wall of the nose. In the anterior and the inferior part of the lateral wall, here as we can see, are made up of the cartilages which include the septal and the alar cartilages. Rest of the entire lateral wall is bony, which is limited above by the nasal roof and floor by the palate, mainly the hard palate, separating the nasal from the oral cavity below. So these are the bones which make up the lateral wall. So in total, the bones include the nasal bone number 1, then comes the frontal process of the maxilla, the lacrimal bone, the superior and the middle concha, which are the part of the ethmoid. Then there is the perpendicular plate of the palatine bone, the inferior concha below, and the posterior most part by the medial pterygoid plate. So these are the bones making up the lateral wall. Moving on to the features which are seen in the lateral wall. The lateral wall of the nose is not uniform or even throughout covered by the mucous membrane. This lateral wall represents certain elevations which are called as the conchae. They are called as the concha. So there are three concha. There are three conchae which are named as the superior nasal concha, the middle nasal concha, and the inferior nasal concha. So the superior, middle, and the inferior nasal conchae are the elevations present along the lateral wall of the nose. Bony elevations seen along the lateral wall. Deep to the concha, when we lift the concha or separate the conchae, deep to the concha lies the space which are called as the meatus. So there is superior meatus deep to the superior nasal concha, there is middle meatus deep to the middle nasal concha, and there is inferior meatus deep to the inferior concha. So this is about the features presenting the conchae and the meatus. In the anterior-most part, that is the area in front of the inferior meatus, that is the anterior inferior part of this lateral wall, represents the area which is called as the vestibule seen here. This vestibule which is seen in front of the inferior meatus is cutaneous, that is it is lined by the skin containing the hair. The area in front of the middle meatus is covered by the mucous membrane and it is termed as the atrium. So this space which is seen in front of the middle meatus is named as the atrium. This atrium above is separated from the vestibule below by the mucocutaneous partition or the mucocutaneous ridge which is seen over here, called as the limon nasi. So the limon nasi is nothing but the mucocutaneous ridge separating the atrium above from the vestibule below. The atrium is limited above by the agar nasi. The atrium is limited above by the mucous ridge here, which is called as the agar nasi. So the atrium is present on, the atrium is limited below by the limon nasi and above it is limited by the mucosal ridge which is called as the agar nasi. So these are the features present in the anterior most part of the lateral wall. The lateral wall is very important as we see most of the paranasal air sinuses opening into the nose through the lateral wall. So the lateral wall receives the opening of all the paranasal air sinuses. We'll just move on to the features one by one. This is the atlas view where we can make out the features of the lateral wall. As I have already discussed, the lateral wall is represented by the conchae. The largest of all is the inferior conchae, which is seen here, which is a separate bone. The inferior conchae is located about 1.25 centimeters in front of the nasopharyngeal opening. So it is seen about 1.25 centimeter in front of the opening of the auditory tube, which is also called as the pharyngotympanic tube. Then next, deep to the middle concha. In this picture here we can see the section of the lateral wall where the conchae has been removed. So as I have already told, the space deep to the conchae makes up the meatus. The space deep to the conchae makes up the meatus. So here this is the inferior meatus. As we can see, this inferior meatus receives the opening of the nasolacrimal duct. The inferior meatus receives the opening, as I have shown here. The anterior end of the inferior meatus receives the opening of the duct which is called as the nasolacrimal duct. The opening of the nasolacrimal duct. Then moving on to the features of the middle meatus. The middle meatus has got two important parts which is called as number one, it is called as the bulla ethmoidalis, and number second is called as the hiatus semilunaris. The ethmoidal bulla number one and the second is called as the semilunar hiatus or hiatus semilunaris. The ethmoidalis bulla is the bulge seen. It is the mucosal bulge present in the middle meatus. Deep to the just beneath the ethmoidal bulla, there is a crescentic space which is called as, there is a crescentic space seen here immediately beneath the bulla ethmoidalis, which is called as the hiatus semilunaris. The bulla ethmoidalis receives the opening of the middle ethmoidal air sinus. I repeat, the bulla ethmoidalis receives the opening of the middle ethmoidal air sinus, whereas the hiatus semilunaris receives the opening of the maxillary air sinus. So the maxillary air sinus is seen opening. This hiatus semilunaris receives the opening of the maxillary air sinus, whereas the bulla ethmoidalis receives the opening of the middle ethmoidal air sinus. The middle ethmoidal air sinus. The anterior end of this hiatus semilunaris give rise open into the infundibulum. The anterior end of the hiatus semilunaris opens into the infundibulum. The infundibulum receives the opening of the anterior ethmoidal air sinus. So, the anterior ethmoidal air sinus is seen opening into the infundibulum of the middle meatus. Infundibulum of the middle meatus. So the middle meatus receives the opening of the anterior ethmoidal air sinus through the infundibulum. It receives the opening of the middle ethmoidal air sinus in the bulla ethmoidalis, and the semilunaris, that is hiatus semilunaris, receives the opening of the maxillary air sinus. The summit of the infundibulum here, the summit of the infundibulum receives the opening of the frontonasal duct. So the summit of the infundibulum receives the opening of the frontonasal duct, which receives the frontal air sinus. So this is about the features present in the middle meatus. So we can make out the openings in the lateral wall in this diagram. So as I have already told, the inferior meatus receives the opening of the one duct, which is called as the nasolacrimal duct. The middle meatus represents two features. One is the bulla ethmoidalis, number 1, and second is the hiatus semilunaris. There are two parts present in the middle meatus. The bulla ethmoidalis receives the opening of the middle ethmoidal air sinus. The floor of the hiatus receives the opening of the maxillary air sinus as seen here. This hiatus semilunaris opens into the infundibulum, which receives the opening of the anterior ethmoidal air sinus. The infundibulum, the summit of the infundibulum receives the opening of the frontal sinus. It receives the opening of the frontal air sinus through the frontonasal duct. So these are the openings seen in the middle meatus. So the middle meatus receives the following opening. In total, it receives the opening of the 4 paranasal air sinus. That is, number 1 is the middle ethmoidal air sinus. Number 1 is the middle ethmoidal air sinus into the bulla. Next is the maxillary air sinus into the floor of the hiatus semilunaris. Next is the opening of the anterior ethmoidal air sinus into the infundibulum, and last is the opening of the frontal air sinus into the summit of the infundibulum through frontonasal duct. The superior meatus, which lies beneath the superior concha, receives the opening of the posterior ethmoidal air sinus. So the posterior ethmoidal air sinus is seen opening into the superior meatus of the lateral wall. Lastly, above the superior concha lies the depression, which is called as the sphenoethmoidal recess. So this is the depression which is called as the sphenoethmoidal recess. The sphenoethmoidal recess, which is present above the superior concha, receives the opening of the sphenoethmoidal air sinus. So it receives the opening of the sphenoidal air sinus. So the sphenoidal air sinus opens into the sphenoethmoidal recess present above the superior concha. So these are the openings present along the lateral wall of the nose. So there are three ethmoidal air sinuses. Out of the anterior, middle and the posterior ethmoidal air sinus, the middle and the anterior ethmoidal air sinus opens into the middle meatus, whereas the posterior ethmoidal air sinus is seen to open into the superior meatus of the lateral wall. So these are about the openings of the paranasal air sinuses. In this view, we can see the blue arrow indicates the opening of the sphenoidal air sinus into the sphenoethmoidal recess. The X-ray view showing the sphenoidal air sinus here. Next, moving on to the arterial supply of the lateral wall. The arterial supply of the lateral wall is by the branches of the facial artery, the maxillary artery and the ophthalmic arteries. It is divided, the lateral wall is divided into 4 quadrants and each quadrant is supplied by the respective arteries. So the anterior-superior quadrant of the lateral wall is supplied by the anterior ethmoidal branches coming from the ophthalmic artery. The anterior-inferior quadrant is supplied by the branches of the facial and the greater palatine arteries. The posterior-superior quadrant is supplied by the spinopalatine as well as the greater palatine arteries, and the posterior inferior quadrant is supplied by the branches of the greater palatine artery, which pierces the perpendicular plate of the palatine bone seen here. So this is about the arterial supply. So this is the atlas view showing the arterial supply of the lateral wall. As I have already told, the branches from the anterior ethmoidal artery, the branches from the nasal artery, the greater palatine artery, the spinopalatine, all of which reach the lateral wall to supply. We can also see the picture where the arterial supply of the nasal septum is also appreciated over here. Moving on to the venous drainage of the lateral wall, the veins form the plexus from which the blood drains into the facial vein in front. So in the anterior part, the venous drainage is into the facial vein, the retropharyngeal vein and the pterygoid venous plexus behind. So behind, the veins drain into the retropharyngeal and the pterygoid venous plexus and the inferior cerebral veins above. So this is about the venous drainage. Lastly, moving on to the nerve supply and the lymphatic drainage. The nerve supply is divided into the sensory nerve supply here and the secretomotor nerve supply. The sensory supply, that is a sense of smell, the special sensory is from the olfactory zone here. So the olfactory zone, from the olfactory zone is supplied by the olfactory nerves. So this is about the sensory nerve supply. The nerves of general sense is from the rest of the lateral wall, which is carried from the following nerves, that is the anterior superior quadrant. The nerve supply is by the anterior ethmoidal nerve, which is the branch of the ophthalmic. The anterior inferior quadrant is supplied by the superior alveolar nerves coming from the maxillary nerve, whereas the posterior portion is supplied with the branches coming from the pterygopalatine ganglion. That is, the posterior superior quadrant is supplied by the lateral nasal branches and the posterior inferior quadrant is supplied by the palatine nerves. So this is about the nerve supply. When we talk about the secretomotor supply, the postganglionic secretomotor fibers for the nasal glands are derived from this ganglion, that is the pterygopalatine ganglion. So the nasal glands are supplied by the postganglionic fibers coming from the pterygopalatine ganglion, which receives the preganglionic fibers from the this pterygopalatine ganglion receives the preganglionic fibers from the superior salivatory nucleus. It receives the fibers from the superior salivatory nucleus. So this is about the secretomotor supply. So this is the atlas view showing the nerve supply of the lateral wall as well as the nasal septum. We can make out the nerves reaching the lateral wall, which are the branches of the ophthalmic, and also the branches from the maxillary from below, and the posterior part of the lateral wall receives the nerve supply from the palatine branches, and the nasal branches coming from the ganglion, that is the pterygopalatine ganglion. So that's all about the lateral wall of the nose. So we have studied the lateral wall of the nose in detail regarding its structure, the formation, the bony framework, the openings of the paranasal air sinuses along with the blood supply, lymphatic and the nerve supply. Thank you.